Good morning, California.
Good morning.
My name is Tanya Kraege. I am the Director of Peer Services here in Madison, Dane County, Wisconsin. So we're a couple hours ahead of you all. I'm a person with lived experience. I also have a wealth of other knowledge. I've been working in the field of substance use and mental health for about 15 years. I got the opportunity to walk alongside folks as a CCAR recovery coach, CCAR standing for the Connecticut Community for Addiction Recovery. I'm also a Wisconsin certified peer specialist, Wisconsin certified peer specialist trainer, and also I moonlight as a clinician, also on the other side to be able to impact folks in different ways in that space to help them understand what voice choice informed consent is and self-directed lives outside of maybe what a clinician would normally embrace. I just want to say my pronouns are she, her, hers. Today I am wearing black coat. I have a green shirt on. I'm wearing some jeans. I am a white woman. I have blonde hair and green eyes. In the background, I have a mandala kind of hanging, just for those folks who are visually challenged. I just like to do a description of myself. And it is not balmy and sunny here. It is very cold in Wisconsin today. So, but it is 40. So that's kind of like a heat wave for us. And Christina, go ahead.
Good morning, California, one of my favorite states to visit. It's been a while, but I have family out there and enjoy visiting often. Thanks, Libby, for the introduction. Again, my name is Christina Vaccaro. My pronouns are she, her, hers. I am recently, our titles changed a little bit. I'm the Director of Peer Operations, so I focus a little more on the inward process of how things are done, pay close attention to the budgets and the spending of our several different funding streams. I'm a certified peer specialist in the state of Wisconsin. I'm also a CCAR coach and a CCAR trainer. Um, for a visual description, am a white woman with long blonde hair. I'm sitting in my home office. My dog just walked in and is my supervisor, so he usually sits in the background here with me. I'm wearing a black and white sweater. Yeah, so super excited to be here and talk with you all. Thank you.
So the title of our talk today is called Leveraging Technology for Seamless Peer Services. I just want to say I understand, even from my own experience, like talking about data is not the most fun thing in the world, right? So we'll try to spice it up as we can, and make it interesting and fun for you all, understanding that data isn't always our first language. For some of you all, it might be. We've been in some of these talks before, and it gets the data folks really excited. So we'll see what we can do here today. Just want to make some quick disclosures. We both work, Christina and I, at Safe Communities in Madison, Dane County, where peer services are provided. We will be talking about some of our work that we do there, as well as we are co-founders of Ventus Rex, where Rex, the peer provider software that helps us kind of track, manage, and do all the things that we've been able to do since COVID. We launched it in 2020, just as the world was kind of shutting down a little bit, where it's housed, and we also have shares in the company. So we just like to be upfront about that. Quick overview of what we'll be discussing today. So we'll be talking about the peer program data challenges that many of us have. I know historically we've definitely had data challenges, and as trends shift and grow, as well as funders and what they'd like to see in their outcomes change all the time. So we've had a lot of frustrations about that, around that, and how do we figure out how to make this work for the peers, as well as for those of us folks who are watching kind of how our dollars are being spent and making sure we can keep the doors open so that people continue to get the services that they need and deserve. Utilizing data approaches to peer work to be able to show that great work that we are doing to ensure that those evidence-based practices are being reported out on so that we can also continue to get the funding coming through the door for the services. Evidence-based practices and being able to obtain more funding, like how do we grow our programs? And we'll discuss kind of our journey in that space.
I'm sure most of you are aware, since this is a peer workforce conference, what the role of a peer provider is. I know that it can look a little bit different from state to state and what they consider a peer provider. So I want to just give a brief overview for those who may not be as familiar. Maybe they're coming to this conference to learn more about what peer providers do, or maybe what that looks like. Um, this is in no way all-encompassing of what the peer role may look like. It could include peer mentors, recovery coaches, peer support specialists, et cetera. Peer provider or provider from henceforth in this presentation is referring to people working with individuals experiencing mental health, substance use challenges, or adverse life experiences in a variety of different settings. And that looks like meeting people where they are at, holding safe space for people to share their experiences. Oftentimes, peer provider has their own lived experiences to really kind of connect with folks experiencing challenges, advocating for needs to be met and to be treated and met with dignity and respect, encourage a comprehensive wellness model, making sure they're connected to those teams and different providers that are involved, brokering for resources, making sure basic needs and other community community needs are being connected with. And then just to be that person who understands, is patient, and is free of judgment, trauma responsive. But I think I'm probably preaching to the choir, so I don't want to spend a ton of time here. So how did we get here? Tanya and I have been at Safe, her close to 7 years, me about 6.5 years. We started off with just a couple of peer providing programs, a pilot program, responding to the emergency department to respond to people who had experienced a drug poisoning overdose and were presenting to the emergency department. Since then, we've grown tremendously. There were 2 peer providers, then we have 17 now, Tanya, 18?
20.
Yeah, most of which working full time, which is great, but in a short time, it was a tremendous amount of growth for a small organization. We are now in a variety of community-based settings. And once we got a big contract to move into our jails and into our treatment courts here, we were scrambling. We recognized that the funding requirements to receive these dollars looked really different from funder to funder, and they just were not consistent. And as supervisor and manager, we were spending a ton of time processing all of the different work and collecting the data and re-entering data. And we soon began looking for some sort of system to help us organize the work that we were doing, so that we could continue to grow in a way that we were providing our funders what they were requesting as far as reporting, as far as invoicing out. And we really couldn't find anything. We created something to use internally, a piece of software that we could use to organize our day-to-day activities and make our lives a little bit easier, because we were spending so much administrative time. There was a lot of error, entering, re-entering. Our peer providers were walking around with like locked boxes to keep their documents in and their paper-based forms in, and it just really posed some significant challenges. So that's how we got here. This is how we got to where we are now. What Tanya's showing us, I'd be lugging that thing around to protect people's information. And so that's really how we got to this point. And we set out to create a solution that worked for us in our organization. And we network a lot around the state, Tanya around the country, doing some consulting stuff. And we would show them, like, this is how we're organizing our data. And people were like, wow, where did you get that? Like, how do we get that? And we're like, oh, we don't know. That was never the plan. Like, we did this for us, but we really started to recognize the challenges that we were having were not unique to us, and that other agencies and supervisors and program managers and peer providers were struggling with the same challenges. So we were able to create what is REX, and we'll kind of dive into that and what we found working with other organizations, just become available to other organizations, about those sets of data, like what is important to collect, and what we've learned and what other people have told and shared with us that is important, and how do we collect data so that as a whole, across the country, we have these sets of data to support. We know that peer support works, but how do we collect data to really support that and keep it person-centered and non-clinical? So that's kind of the overview of this, and Rex is just the tool that we use to do that. So
Yeah, I just want to share a little bit that like when I started at Safe in 2016, my primary purpose at that time was to develop a program called Pregnancy to Recovery, which is working birthing folks experiencing pregnancy challenges. And because I didn't have a great way of kind of looking at points in time, like how they came in, and then after a few months of service, when we did our CDC end of year, kind of end of grant cycle reporting, a lot of that data was more narrative in nature rather than really points of data sets. And lately now we've been able to really show like from person to person, kind of where they come in. We have, whatever questions that you want to ask that are valid and important to a person's journey, whatever that journey is that you're looking at, you can show the changes in time. So it's really helped us to be able to create that narrative or that picture around what's occurring in someone's life, other than me writing a story about it that looks a little different. Although me being a person who likes to hear stories, it works for that, but it doesn't always work for our funders in that way. So data problems as you scale. So there's a lot of challenges or a lot of points of data that we look at throughout the program development, right? We look at participant data. So really being able to look at those life changes in somebody's life, that their housing insecurity, maybe their food insecurity, basic needs. What are the things that the person that you're providing services to need? And how are those needs met throughout the duration of services? Beyond that is the provider data. So we are able to now look at how our team is doing on a regular basis. We're able to track in and they're like how many people that they're working with, what's the time frame from the time of like when you gave them the referral to when they first reached out to that individual, because at our agency we like that to be within 24 hours. Obviously, if somebody's responding to an emergency department call, that's going to look a little different. That's pretty immediate. They have an hour to respond to the emergency department. As well as it's helpful for us to see like when are the bulk of those calls coming in. We do have a 24-hour helpline in our community, so anybody at any time, no wrong door, can call in for services and either do a self referral or do a warm referral through other agencies in the community. And so we're able to track, how does that look? When are those calls coming? Being able to look at successes, and then success, of course, is always in the eye of the beholder. So the beholder generally is our funders in a lot of areas. So whether that's a grant that we wrote for, we've been able to kind of shift out of hustling for our worth and doing grant work and really being able to do more contractual work. And so we're able to kind of set the rules a little bit more now by being able to show outcomes through Rex. We're able to be a little bit more selective on how we diversify our portfolio, and our success has been determined by what like our agency says is success. And that's based on peer success and not necessarily what a funder is saying. Being able to report out on multiple things. So looking at points and times, either throughout an individual's time in service, kind of their points of success, maybe that reduction in use, maybe that entry into, treatment for mental health services, maybe it's getting access to domestic violence, housing, being able to get services for maybe gang affiliation and being able to get out on that. So that's individual reporting. And then we can look at like overall like agency and the peer engagements as a whole. In addition to that, we have a lot of billing that we do now, and we have invoicing that we have to report out on, as well as like the county gives us a significant amount of support, and so being able to kind of show them the number of hours that we do in a month and things like that in order to keep those direct service dollars coming into the agency. And then we can also use that data to improve services, right? So as a team, like, are we responding to things appropriately, adequately, and in enough time that we say that we're going to do? And if we're not, we can look at what are the barriers? Where are the adjustments that need to be made, as well as like our staffing needs? If we have a certain number of people in services, which, for many people, serving 1,000 people a year would be small in comparison if you're looking at metropolitan areas like Los Angeles or Chicago. For us in Dane County, Madison, we're the capital city, but we only have maybe 400,000 people in our community, and that's when the students are here. So we think that we serve a significant number of folks in any given year, considering the size of our community. And we can look at our data to improve services. Are there communities that we're not reaching? Are tracking LGBTQIA plus outcomes, Black and Brown communities, and really what their individualized needs are based on community needs, rather than what we think is helpful for them.
In order to provide effective peer services, we need to understand all of the data that's associated with the participant, including their history, which can go back many years, their self-identified recovery status, what their interests, and all of the information associated with them. And this kind of stays with them too. So when these sorts of things are tracked, it's tracked over time. It remains with the individual. If they were to return into services, it would be a separate engagement, so almost like a glimpse or period in time, so that over time the data is collected in a way which can be based very much so on the individual without having to duplicate questions. You might update them, but you don't have to start all over. We want to make sure that we don't have participants duplicated in the system, or that it is overly cumbersome to find information about participants. This is not only important for administrators, but also extremely important to providers who may be faced with situations where they need to quickly reference historical data and information to provide the most effective peer support and engagement.
Sorry, I was on mute. Beyond that, participant and versus provider data. So we're able to use the referral form to translate into recs and then do provider matching. So based on kind of lived experience, whether that's through substance use, whether that's through DV experiences, what are the things that you like to do in your free time? Are you a person that's single parenting? Did you have a child while you were using? Things like that that we could use to really try to match up a little bit of that lived experience from the provider side to the participant side. It's not a perfect thing, right? Obviously, if somebody is working with somebody, you're not married to your peer provider. So at any given time, you can say like, this isn't a good match, but it's just another way to get some loose information to be able to preliminarily make that connection before the formal like human interaction has occurred, to try to build that bridge. And so we would get that on the referral side from those coming into services that would just kind of say like, what are the things that you would like to do? Or if you can't remember some of the hobbies that you used to do, what are the things that you would maybe like to learn in the future or get back to? Or if your life wasn't so chaotic, what are the things that you can identify in having fun? And we really try to support those things, right? Even as an agency, and getting those folks kind of connected to either community services that can help them get engaged while walking alongside a peer, or looking into like dollars or some fundraising stuff to be able to say like, oh, we'll support a camping trip, or we'll support a conference if that's something that makes sense for us.
Back to kind of the participant data, what we look at from a provider perspective, and then from a supervisory perspective as well, as we're trying to manage the quality of support that's being offered to individuals. These are kind of the ways that we try to engage the peers receiving services, by setting goals, knowing if it's time for a quick outreach, and avoid having participants fall through the cracks. So basically, we'll talk more about the dashboards later, but it really powers the way that the peer providers are doing their work. When they log in, they get to see whether or not somebody might be at risk, or they forgot that they had been assigned a new peer to work with, or maybe they haven't reached out to somebody in a couple of weeks. It'll remind them or prompt them to try to re-engage that peer if that's what they're wanting to do. And this is really helpful from a management standpoint too, right? Like we get a really quick glimpse without having to, be going through spreadsheets or paper, kind of meet and greet forms. We don't prefer to call them intakes, but some of the required information that we collect based on what our funders are requesting of us. But this really gives us an oversight too, like, hey, like maybe this peer provider is having some challenges. It looks like they haven't reached out to many of their peers in a while, and gives us kind of maybe a cue to check in with them for a little extra supervision, make sure that they're feeling comfortable doing the work, or maybe there's something personal going on in their life that is causing them to not be able to do the work. So really, this is a way for us to make sure that people that are requesting our services are indeed getting connected with their peer providers. And then, of course, we can use this participant data over time, right? Like if we're setting goals and it's, their self-identified goals, of course, they can see over time how they're progressing in their goals. And it also is a way for the peer provider, if maybe they're spinning their wheels, or, not connecting or engaging in a way that they feel like is beneficial. They can go back to that and say, hey, like we talked about this, and these are what we were going to work on together. How can I support you in reaching these goals that you determined? So just a lot of different ways and tools to try to engage the participant, and then from management's end, making sure that people are getting connected with.
And it's really a lot easier to do like support from a supervisory standpoint for our individuals, because we can pull up everybody and they don't have to lug in their big black box that's locked to go through these things. It's really there, and they can kind of, flag it to be like, these are the folks that I really need to talk about, and ask a feedback on maybe how to work through a challenging situation that the peer and them have not been able to come, find feasible solutions for them. And it's just a lot easier to be able to see like all the folks that they're working with on one thing now, and they can literally like go down and kind of review progress in that way. From the provider side, so we actually call them peer loads now. So rather than, inferring that people are cases by any way, shape, or form, but provider data is from my standpoint as a director, or we now have team leads too that help kind of disseminate where folks are going. And every person on our team is at a different status. So they could be PRN, which is what's considered like as needed, but they work with maybe 10 to 15 people in a given week and get anywhere from 5 to 15 hours. We also have part-time folks and full-time folks. Part-time would be 20 hours or more, and then full-time is 32 or more, and part-time and full-time folks get like PTO, and full-time unlimited PTO, and full-time folks get, healthcare benefits as well. But we really are able to look at like, where is this person at today? What is their capacity? Even if somebody is maybe assigned, 40 people, I don't want to assume that they're at capacity when only 5 of them are actually engaged, because we're a harm reduction coalition. And so we really meet individuals where they're at, like no matter where they are in their quality of life journey. And so many people like don't have phones. We spend time trying to like connect with them without them having a phone. We have a very large houseless population here in Dane County. And so some of our peers will like run around and try to find, maybe the corner that they're standing, doing some panhandling at and things like that. And so we don't always make the assumption that based on the number of people that people are working with, that they can't take more. So this just gives us a glance at like how many folks they have in services right now based on the entirety. And then we reach out, of course, individually before assigning out a new individual to them to make sure that they do have capacity. But this at least helps us get that quick glance of being able to look at who's full-time, where, how many people they're working at now, so we can reach in and say, like, can you take another person, or can you take a few people? And it's how we support our team. We leave it up to our peer providers, the number of folks that they feel comfortable with, because they're going to know on their side, like how many people are engaged and how much they're engaged in the program.
Another really great feature, which came from a challenge that we experienced. In the state of Wisconsin, we have to keep track of CUs for recertification purposes. And what we found is that, I mean, I myself, I'll be really honest, struggle with keeping these. So I like throw them in a folder in my email or whatever. We made it so that they were able to add it right into their like provider page. So it's almost like you could think of it as like an HR file, right? They can see all of the information kind of about themselves, but they can also track their CEUs. We have different domains, so you can choose, and this is completely customizable depending on the needs of the particular state or governing body of whoever is certifying peer specialist. Maybe it's for personal use if somebody just wants to keep track. But you can enter them, you can choose the domains, it'll keep track for you. And then when it's time to recertify, it's all right there and you can pull it right out of there. If we had providers leave and they didn't have access to this information anymore, we would still have access to it and be able to pull that out and send it to them. So they would never lose that information. They track all of their hours and mileage. They can do reimbursement right out of this as well. So this was another administrative headache for us. A lot of our funding is very much so based on the direct service hours spent with an individual, which I'm sure is similar to many other folks in this room. But what gets challenging is like, yes, this person worked for 6 hours, but trying to remember which participants they spent time with, how much time, and what they were doing became challenging. And then there would be like a 5-page sheet. And then I'd have to go through and I'd have to write down every different program, the participant, tally up how many quarter hours they spent with the individual, and then give it to the accounting department, right? So it was like, oh boy, lots of error because I am a human. And after you're staring at, 500 rows of people's time, your eyes are tired. You don't even know what you're looking at anymore. And then again, that error, right? Human error comes into play. So this really allows people to see. It also helps from that supervisory standpoint too. Like, hey, I see you spent, 10 hours with this person over the last week. Is there something going on with them? That's a lot of time to be spending with an individual. How can I support you in that? What other resources may we need to bring in? Just gives an opportunity to kind of check in on our providers, but also the people that they're working with as well, and just provide another opportunity for some supervision around what may be going on. So again, just that higher level of tracking, it really helps us feel like we know and can be responsible to our funders when they ask us questions. We have those answers at our fingertips. And then again, just supporting people in real time, right? Like we know what's going on. We know what things look like. We know where they're spending their time and how much time. We can also identify any technical issues they may be having, because while this was made to be really kind of a click and go, we know that some people in the peer providing space maybe don't have that technical background. And we designed it with our peer providers input on how to make this as accessible to people as possible, so it's not burdensome and people a lot of EHRs or case management systems that we looked at were very much so required a higher level of technical ability. We really wanted to make this accessible in a way that we could support people in using this. But it also gives us the opportunity to find when they may be having challenges with that as well, and put in some support plans.
Yeah, I have one person that I thought for sure you were gonna have them write everything down and enter it in for them. Um, because they struggle with checking emails and going on Slack, and they're actually killing it. So they pleasantly surprised me, and it's been great to see that. So it definitely has reduced the administrative burden on us to free us up to do more of the things that we love to do, which is working with people rather than documenting and screen time. So next we talk about like success data, like how do we measure success? So as I stated before, we are a harm reduction coalition. When I first stepped into this space of doing this work and kind of supervising and then managing programs, our success outcomes looked a lot different than they do today. In the beginning, when we launched our ED to Recovery pilot project in 2016, the point of success or the outcome there was like we had a 90% success rate in linking folks with treatment and recovery services post overdose from the hospitals. And so from that information, we were able to turn around and show that, this works, and here's why it works because of, this number that we had that was pretty good in comparison. And so, but from that, though, we've changed a lot of the way that we look at quote unquote success to really be meaningful to the individual and not so much what society might be expecting that success looks like, which is like possibly abstinence-based recovery or engaging in a certain type of treatment program. We know that not every person who finds whatever recovery that they're looking for does not ever enter into formalized treatment. And so we had to shift kind of how we were looking at success, but like metrically, that was hard to do in Excel spreadsheets and paper-based reporting because we weren't able to necessarily show the outcome in the same ways. So now we've been able to put in and align more of the work that we do with the peer research across the country, which is like looking at self-reported points of success, right? One of them is quality of life. So we built in a self-rater that is asked by the peer provider. Eventually it will be outward facing, so we can just give it to somebody or give a link to somebody and they can enter it, anonymously or not with somebody there. But currently it's, part of the peer relationship is saying, ever so often, depending on how we want to set it up, we want to ask every 2 weeks, every 4 weeks, every 3 months, we can set that up. But we ask them on a scale from 1 to 10, how would you rate your quality of life today? And then they answer that and we enter that in, and then we're able to show, I think in one of these graphs, the self-rating over time, kind of those changes or shifts for that person, and have it be outward facing too, so that the peer can see like, here's what you've shared your life is talked about, and even be able to give a visual point to say like, oh, remember during that time, that was when you lost somebody that was close to you, right? And so it makes sense that you would be feeling, these types of things, as well as we can do a self-rating and looking at that and compare it to show the frequency of use over time, which is, it's really interesting. Sometimes we'll show that and the frequency of use will be higher and their quality of life will be higher. So sometimes people will say like, my life is doing really well right now and I'm using every day, and that's okay, right? Like, but that's based on what the individual is experiencing, not what me or anybody else thinks that that person should be doing. And so when we report out now, more so to like funders or maybe the news or things like that, when we talk about efficacy or outcomes, we really focus in on what individuals have reported to us rather than what society thinks is important to see. And then we can also improve engagements with, services and support through that, depending on, we track we try, right? Because we're still humans doing human work. And so we really want people to stay working with people and not so caught up in the minutia of all of this stuff. but definitely we can show like any recommendations that we made into services in the community, whether it's a food pantry, whether it's for, diapers over here. We have literally every single resource in our community loaded into this so that a peer who's working in the field can pull up on their phone and be like, I'm looking for housing needs right now. And every single housing provider will show up for them. Or I'm looking for a specific probation and parole agent that's literally like in there too, and then it'll pull down their contact information so that they can connect with them if they need to. And the goal is to improve like whole health and chronic conditions, right? And that's based on, again, what peers are sharing with us. Are you having your basic needs met? Are you feeling like you're supported? What other things do you need? Those are the things that matter to us. Some of the things that we also have tracked is like a decrease in hospitalizations. And we're thinking more in the way of like negative consequential, like hospitalizations that directly are related to maybe suicidal experiences or drug poisonings or anything that might come out of use, super high anxiety, things like that. So we're looking at them decreasing using those services, which may not always be the most trauma informed and the most appropriate place for people to go, and really leaning into those community resources a little differently, as well as like experiences of mental health. What services do you need? What services are you lacking? Do you even want any services? And a lot of our partners are really based in peer services. So we want to connect people with like-minded individuals that are really going to treat people with dignity and respect and kindness and show up as an ally and an advocate in spaces rather than subjecting them to possibly oppressive systems that they've already engaged with and have had, increased trauma from interfacing with those systems.
Sorry, I was on mute. To kind of piggyback off of that and just to look at how we actually quantify these success metrics, we are able to pull all of these things into reports and then into visuals, which is really helpful, especially when we are asked, because a lot of what we are measuring is not like typical, like, clinicians and other folks may consider success to be completion of treatment or completion of treatment goals, where we've tried really hard to find different ways to get buy-in from funders and from other places when we're looking at continuing to do this work. What are these other areas we can look at to make a case, right? We know it works, but how do we tell our story, really? So these are some of the different areas we've identified that we can actually pull out and make a visual case, not only just for funding purposes, but for agency partners, right? One of the things that we also track is recommended resources, right? We can say, hey, like we recommended your organization 73 times this year, and it looks like it was followed through on this many times. Can we partner closer? Do we need to look at having a more formal partnership for our community, for the population we serve and we share in that serving? So it helps to also build partnership, right? And strengthen maybe existing partnerships. So some of these other success metrics we use is substance use over time, again, with the goal for us not being abstinence. These are all person driven. How many goals they achieve, their recovery oriented goals. What does that look like? And we have a progression so they can see where they're at in their goals. And then when they complete their goals and celebrate that, right? Employment and education, legal and criminal justice involvement, basic needs, making sure that we're checking in. We check in with our folks all the time, making sure that their basic needs are met, right? We know that it is really hard for an individual to focus on anything more if their basic needs aren't being met and they're hungry. They're not thinking about how they're not going to use today or what coping skills they can use to not use or improve or practice self-care, right? They need those basic needs met. So we check in on those a lot. And then over time, you can see that the basic needs have been met. And when we continue to ask, that those have been fulfilled, which is success in itself, right? Somebody's basic needs are being met now. That's successful. And then again, like Tanya talked about, that quality of life and mental health over time. And these are tools too. I just want to add that depending on the organization's need or want, they auto generate. So when the provider is in kind of working that engagement or file, if you will, for that person, these are just going to pop right up. It has a little smiley face on the screen if they have all of their things up to date and filled out. It can be auto populated as much as you want. And the peer providers do not like when it's a sad face. It's like a little sad emoji. And they're like, oh no, I have a sad emoji. I need to fix it and make it smile. And then they get so happy. But it's just a reminder or incentive for them to make sure that we're collecting this information. And again, we don't want this to be about making people a case study or anything else. This is just really to benefit the peers being able to engage their people too. Like that's how we explain it to them, right? Like this helps us to continue to move this field that we are all passionate about forward. We're able to share some of this locally around the country. Like this is how we've done this. This is how we're measuring success. So just to kind of get their buy-in too, like it's helping you to do your job, it's helping the peer that you're serving, and it's helping kind of the organization to continue to get and attract new funding, as well as sharing out nationally. So it's been pretty neat.
And all of it is peer driven. So like all of the things that we've learned to quantify as success metrics in a lot of ways are either driven by the peers that we're serving, and they're like, oh, I got my child back. That's a really big success thing for them. And so we're able to kind of add that in, and or peer providers on our team, they pretty much, between us and everybody else that operates on our team from a very diverse group of people, have really developed what they want to see have happen in here based on their own lived experiences too. So it's not necessarily all funders that came in, like our introduction stuff, basically demographic stuff is funder driven, but outside of like moving the needle forward and trying to look at, how we think quality of life has improved, that has really been driven by the peers on the team and the peers in the community that we work with. More success data is looking at that program quantitative data. So looking at like total service minutes, and we can really break that down into looking at what is the fraction, or what is the bucket of like direct service look like in comparison to those non-service hours, so that we can make adjustments as needed. Similar to like, in the clinical space, right? If I'm working 8 hours, I'm expected as a clinician to, pull kind of those 5 hours of working with people during that 8 hours. And then like 3 hours is loosely like that documentation time or other things. So we're able to kind of drive our staffing needs and look at programmatically, how do we need to shift? And there are multiple programs that we have. Some of them are more of that administrative hours. So they're working like 30 hours in a space where it's not like direct service driven, but we're able to really see at that wealth of like, where is the work being done? How many minutes of service are we producing in a given month? To be able to also share with our board too, and say like, this is why these services are critical, and they're useful because we are really spending a lot of time with folks that need it in the community. Being able to spend less time in documentation, which means that we're not soaking up additional administration time. It used to take me about 10 hours to do a payroll every 2 weeks, because I was going through individual papers and then checking on the Excel. And I think a lot of our peer providers weren't paying themselves, because come payroll, they were just like, I just want to get this done and I want to get it in, because I know I have, this timeline. And so they would cut themselves short. And as we know, this work is very, very hard, very, very rewarding. And I think everything that our peers do, they should be compensated for that work that they do, as well as we're able to kind of look at like, okay, you're spending a lot of time. You haven't had a vacation. You have this unlimited PTO for a reason. Like, why don't you, like, how do you feel about taking, like the next 4 Fridays off to at least give you like a longer weekend, so that you can, come back refreshed, looking at additional data across the country about burnout time for peers is about 2 years. I think we've been a little bit blessed at our agency, I think through the things that we've done in place to kind of keep peers in the workforce and having them feel supported, where we're starting to see that really kind of hone in about 5 years. And so being able to look at like, how do we support you in taking the time off? Because we know that like just time off in and of itself isn't necessarily going to revive somebody for the work. But definitely what adds, I think, to burnout is documentation and kind of the harping on by your supervisors that like, you're not doing as much direct service, you're pulling more admin time. And so we're able to kind of drive the conversations a little bit differently by getting a heads up on it before things start to get too intense throughout our individual supervisions and have those conversations. And then being able to look at, how many folks have we worked with throughout the year? How many people have like left and gone back in services within that year? Because sometimes people do, it usually happens like we'll close them out to services because we haven't been able to connect with them. And it's like usually within a day or two or a week, they're like calling back. They got their cell phone reconnected or they have a different email that they're checking now. And we're able to, reopen them, but we can show like, how effective that the services are by people continuing to wanting to come back. They know they have a safe space. They know they have a judgment-free zone. They know they have this place that they can go to, that somebody is going to understand them and that they're going to help get them to connected to the other services in the community.
This is just a view of how some of this data looks on an aggregated level. This is a look at how the goals looks. So say you want to go back and do some end of year reporting for your organization, or just have an idea and we share with our peer providers, like, look at all the hard work you've done this year. They're able to share with their peers. So it's kind of like this whole approach that's very holistic, right? Like the things that we share can benefit on many different levels, from boards to partners to internally and to motivate, right? But this is just kind of a glimpse of when you pull these reports, what it can visually look like. It's really nice for sharing if, we get called on for the news and things like that. We can share some of these things in a way that's more visual. People seem to be able to kind of digest that better. But it also is kind of, it shows what you're looking at here. I know it's kind of small, but is achieved versus in progress, defined. And these are all the different kind of the process they go through, right? You define a goal, they're working on the goal, they reach the goal, and they kind of see that throughout time. So this gives a snapshot of where all the goals that have been set that year are at.
Mm-hmm. And many people can have obviously more than one. So this isn't necessarily peer driven in the way that it equals the number of folks, because a lot of them have multiple things, long term, short term, but this will just give us a glimpse of like how well they're doing in their goal completion during that year. So just a bigger kind of picture here, I think, to show that frequency of use over time. Again, this is self-reported. They are auto-generated too based on number of completed contacts. So that's like if I met with Christina, for sure, either over the phone or or in person. And then I saw her again in 2 weeks, but during that time we had like some unable to connect times. It wouldn't generate that. It's really like the completed contacts, but it also, there's a way to bypass it, right? So if Christina or I don't discuss that that day, our peers can just be like, unknown, because like I didn't ask them and I don't know anything. But the peers on the other side that we're working with have shared they like to see this because they don't always remember that they have had some success. And so we're able to show them, like, I know that you're struggling right now, but look at like all of these times here where you were doing well, and that you are capable and you can do this. And so try to help support, get them out of that shame cycle and back into that mindset of like, I am worthy and I can do this. In addition, we use the self, like it's a check-in, overall readiness to engage in recovery or engage in recovery support. And peer providers are that. They are recovery support. It doesn't have to be like, again, formalized treatment or anything like that. It's really like, are they wanting to have some support? Some people don't, they want to do it on their own. That's okay. Engage in maybe addiction treatment. Again, that just helps us kind of gauge whether or not we're actually giving them the resources. So if they want to engage in addiction treatment and we don't have any recommended resources for that person to be able to do that, like that doesn't match up, right? Like, and we're not helping them get their needs met. So it just at least gives us a point to be able to view that, like, are people getting the services and supports that they're needing and asking for, and where can we fill in, where are the barriers and where can we fill in the gaps? And then also, again, self-reported frequency of use. Generally, we don't report out anything to anybody that has any names on it. So if anybody were to like see anything, if funders even ask for things, we can pull any reports that don't have any PHI on them. So we're just looking at overall outcomes. So it doesn't have any indicators of like who those individuals are by any means. We want to try to protect that as much as possible. And the only real reporters that we have to give to is like the county, but we obviously let folks know that in order for us to provide this free service, we have to report on kind of at least number of hours we spent with you for that month and kind of your simple demographics.
This is just another visual. We don't have to spend a lot of time on this, but using that substance use information of all of the engagements that were closed, so peers that left services, this is just showing at the end of their services what the frequency of use looked like. So you can see on the right-hand side that it decreased by 2, 3, 5, or increased by 1, 2, 3, 4, or 5 during the kind of life cycle of the engagement that they were having with a peer provider. Again, just useful information to be able to, be able to see what is available to you to share as successful, or what makes the most sense to demonstrate the success of the peer relationship and peer programs that are offered through your organization.
Mm-hmm. Yeah, so like different graphs based on like what you want, what is visually appealing to you and or the funders. It can be line graphs or it can be something like this. I prefer like circles because I like full circles, but it's really just another way to show the story. We can break it down into like simple things like based on like race. We can look at trends across race, ethnicity, gender, pronouns. We can really substance use, like what their identified major challenge substance use is, because as you said, we have people that come in, they're like, I'm here to work on my opioids and my addiction with opioids. I need support there, whatever that looks like, if it's medication for opiate use disorder, if it's safe use stuff, and they have no desire whatsoever to like look at some of the other stuff, and that's fine with us. But we can really break it down in the system to be able to show like, these are all the folks that we've worked with this year that has, this challenge in particular. And these are like the outcomes based on that, that they've completed with major improvement. A lot of folks that we have like moved out of the area. Unfortunately, sometimes they went to the state penitentiary and we are unable to continue to work with them while they're there until about a month before they're able to get out, and then they can re-engage in services.
Sorry, this is again just another kind of piece of visual data for that self-rating that we talked about. People self-rating their quality of life and their quality of recovery. So over time, you can pull in all the participants for a certain period of time and just look as they self-report if during peer services and engagements, if their quality of life and recovery is improving, not improving. It just gives another visual way for you to be able to share these things with the relevant people. It really, you can pull out anything that you choose to collect. And I think the point of this is that how we define and look at success, because I think that we've had conversations, not just locally, but across the country. Like, it's really hard when you're practicing harm reduction or you don't have these formal treatment goals, what success might look like. And so we thought it was important just to kind of share some of the different ideas to get kind of the wheels turning, like, oh, maybe that's something that we could use in our agency to be able to demonstrate success. So, and this is not all encompassing either. Like the needs of different organizations could look really different based on the populations that you serve. But these are just some of the things that we have used to be able to kind of tell our story.
And recovery is all encompassing too. It's not like recovery from addiction or mental health. It can be like whatever that person is in recovery from. It's really their self-identified thing. Relationships, food relationships, gambling, whatever that is. So it's pretty universal in that respect. Additional thing is you can really build in anything. So K10 is one tool that can be used to measure mental health self-ratings over time and know how it is improved over time. There's other things like the BARC-10, Recovery Capital too out there that really look at more that substance use piece, as well as like how what do your natural supports look like? What do you need? Basic needs things too. So this can be built in like however you want to track that. We can make different metrics based on what your needs are. We have the BARC-10. We also have the brief addiction monitor for working with families. So it's not centered in the peer, it's centered with working with family members that we built in there. So when we have our family peer providers working with others, that they're able to ask like family members similar things and kind of look at overall outcomes there. So there's a lot of tools that can be used to monitor changes over time. Depending on what data each individual organization collects, will determine what information is entered into RECs.
You can also track different things that you might be providing to the community. This is just a glimpse at what we track for naloxone distribution. Again, this is helpful if you want to be tracking formally with the system to maybe be able to report out to funders if you're getting funding to purchase naloxone or safe use kits, or maybe it's hygiene, depending on the population that you work with. There is capability to be able to organize and track those things so that it is really easy to give that report out to partners or to continue getting that funding. Also, just to know how much is being distributed, so you know how much to ask for later. The peer providers know for us, naloxone and naloxone training is really important. So we can go in and look at this and make sure that we are getting it out into our community for folks, and that our peer providers are bringing it out there. So this is just one example of the things that can be tracked. Again, it's going to be unique and different for other agencies, and it can easily be changed to accommodate that, but it's just easier than using pen and paper Excel. It's kind of an all-in-one ability.
And using data with participants, again, we kind of touched on this a little bit. This is just helpful for participants who are in the programs to see those moments of time maybe where they were struggling and really see visually their progress over time. Again, like most of our peers, they have it on the phone or they have it on a computer, and they're if they're doing anything, our recommendation is like nothing about us without us, right? So as much as we can do alongside the person that we're working with, the best. And so we're able to show them, and they really get a kick out of it. They're just like, oh, is that me? And it's really cool for them to watch, things change over time as they're working with somebody, and it's really empowering for them to see. Oh yeah.
As a way that data can improve these services through using something to help collect this data. I touched on this in the beginning a bit, but all of the information really does stay with the person throughout any time they come in and out of services. So say they had an ROI, they were in services for 3 months, that ROI is good for a year. They take a 2-month break and they come back, that ROI is still good. They would still be able to, we would still have that on file for them. Things like that would stay with the participant. And by doing this and having these kind of systems in place is super easy if we have a peer provider that has to be out all of a sudden for another person to come in and pick up where they left off without having to do a ton of backtracking and trying to figure out what's going on. It's easily able to be shared or assigned to a different peer provider. They would not, I do want to say too, for security and safety and privacy, only it's very need to know. So only the person that is working with that individual can see that person's information unless one of our other peer specialists is on call answering our 24-hour helpline. If somebody were to call in that was already in services, they would be able to see again so that they can pick up where the last peer provider left off. That's been really important, and we never want to cause unintended harm and asking people the same things over and over again, or not having somebody able to just come and really meet them where they're at and hold support and have to get all this background information again when they probably are already interfacing with a lot of other systems where they're having to repeat themselves all the time is really, part of how we're trauma responsive and showing up for them and able to just pick up where the last person has left off, either through that helpline, or we have peer providers who have to leave suddenly, right? Life comes up, they have a family emergency, that peer is maybe experiencing some pretty big things in their life and they just need that support, right? So this has been huge for us to be able to not, and to allow the peer provider that had to step away the time without the other peer provider who's trying to come in and pick up for them and calling them during something they may be experiencing and asking for a recap or how to meet that peer, what they've been doing basically, right? So that the new peer provider can pick up right where they left off. And that's truly, for me, knowing that we can do that is really meaningful, because I think that people already experience so much repetition, and it brings things back up for them, that being able to do this for our community is big. It's a big thing.
And being able to step out during an emergency, and we've had them. I mean, we've seen so much in our years of doing this where, people have entire like 30 people that they're working with, and then they had a major, loss in their life. And so we want to make sure that this person can like go and take care of themselves. And every single person that they're working with, between me, Christina, and other people on our team, that like we can support their peers in their absence. So we ensure that the peers get the support that they need in their absence, and that person can not be worried, because most of the people we work with are going to be worried about their peers, even when they have big stuff going on, because that's just where their heart is. And so being able to be like, we got this, we know at least foundationally what's happening with your folks, to be able to support them in your absence, just help them tremendously be able to take care of themselves. The other thing is billing. So this has exponentially changed my life, being able to really just pull invoices monthly for comprehensive community services. So we still do have to do some notes for some programs. They're reduced a little bit rather than our DAP notes as clinicians, or maybe SOAP notes, if you've heard of those. They're really meant to stay pure in nature, and we fought for that. We fought with that with Medicaid, just to be like, they're not clinicians. They're just going to say, we met with them in this way. This is what we did, and this is when we're meeting with them next, and not really giving a lot more information. But we can put the service notes in there. They can sign those notes, and we can send them off to our respective billing partners to be able to do that, as well as we can see our spend downs at any given time, based on like the rates of the provider that we pay, and then our hourly rate that we get reimbursed from them. And all of this stuff has really helped create a seamless transition between like our payroll department, our accounting department, and really help us see firsthand from a director side, like, where are we at right now? How close are we to getting through with one contract, so that we have to think about sometimes whether or not we're going to put somebody else in another program, of course, if they qualify, if billing or dollars is running out in another program. It also helps us look at, the profit and loss on at a snapshot, whereas a lot of times we had to wait historically for that once a month meeting or that once a quarterly meeting to see where we were at. And then that last quarter of the year, we're like scrambling because we didn't have all of the information for the year or could see our spend down. So this really helps us be able to keep on track a lot more frequently and usefully than we were in the past. But the service notes is definitely helped improve our lives too, to be able to see that. I can check them before we send them off to make sure that we don't get denied for that billing. And then we're in the red there, as well as being able to insert that signature right into the note. And so it's being able to do this has changed my life exponentially in the way of like, I used to spend so much time in data and reporting and invoicing out that I felt like I was getting burnout in my work. And I was like raised in like social work, helping folks, peer provider stuff. And so I was feeling burnout because I was all the time like not being able to communicate with people. I was spending a lot of time in Excel or going through paperwork, and my administrative hours have been reduced by at least, I would say, 60%, to be able to help me get back out there and have those meaningful relationships that make my job a lot more fulfilling, spending time with the peers more. They just all the time were like, I know that you're busy. I know that you're busy, or you have these things. And I was like, you're my priority. Like, you're my favorite part about this when I get to meet with you. And so the ability to kind of streamline all of this has really helped me be able to get back to doing the things that make my job satisfaction sustainable for me. So looking at how do we diversify our portfolio? So as Christina shared in the beginning, we started off with 2 program budgets. It's very easy to track in a paper-based form 2 budgets. Once we began to grow and kind of get a lot of buy-in from other places that were basically like, we want you to do this work for us and we'll give you some money to do it. We stepped into Rex with about 5 of those different program budgets. Now we have about 17. And so there's no way that we would have been able to scale our programs to be able to bring in more funding and to be able to report out accurately and appropriately to each of those funding sources. Had we not had something like this, we probably would have stayed pretty small, and we probably wouldn't have been able to have the impact that we have in the community in the same way that we do now, being able to serve as many people as we get to do now. As well as being able to look at, as I stated before, like where are we at now? Where do we need to make adjustments? It also helps me determine kind of where do we need to seek more dollars? If we have, so many people in this program wanting services, and we're expending that well before the year is over, in like third quarter, then I can either go back to the funders and say, hey, are you willing to give us more dollars at this time, to be able to continue to meet the need for your county? Or I have to have the conversations of like, we have to stop services until the new funding year rolls over. And usually they find, a way to sustain that based on those conversations. But sometimes we're able then to move and shift people across to different funding streams so they can continue to get this service for free. We do not want them to have the headache of paying for a service that they deserve, while we also understand that we want to pay our employees a living wage, not just, a lot of people when they first start out, they're like, I'll do this for free, it's volunteer work, and I don't need to get paid. And I was like, well, if you're trying to make a career out of this, we should probably ensure that you're making enough money to be able to put food on your table, support your family and things like that. So it helps us be able to ask for additional like cost of living adjustments and things like that based on like where we're at, so that we can continue to give our staff raises as we need and keep up with kind of the national trends around the cost of living based on where you live, and ensure that we're staying above that medium. We want to make it attractive in the way that like they work harder than anybody that I've ever seen in my life, and they deserve to get paid that living wage so that they they can continue working in a field that they're very powerful in, and they don't feel like they have to step away and take a less meaningful job in order to continue to put food on the table. It was just really helped us drive the way that we want to continue to support our staff and look at maybe where we need to find some more funding in the future.
Being able to kind of pay really close attention, like Tanya said, there's lots of different kind of funding streams that an organization may have. Being able to understand and know where you're at in live time in all of those programs to ensure that we're spending appropriately, we have enough funds to last throughout the year, paying really close attention to what things are being put into which category. Again, it helps for financial wellness for any organization to be able to in lifetime have this information at your fingertips and make informed decisions about how you will continue your spend down for the year. There's a lot of different moving pieces in organizations. Looking at QuickBooks for me is challenging. This is a lot more digestible for somebody who doesn't have that background, but needs to know and be able to manage a program and appropriately spend funds, especially when we have federal dollars and things like that. There's certain allowable expenses and costs, and based on our contract, participants can only be under certain funding if they meet X, Y, and Z. So this, again, in real time, lets us see what's being charged to each program, whose time is being spent there, what participants are involved, what we spent, what we have left to spend by program. So you can click into each one, you can get an overall picture, and then you can aggregate it down to each single program. Like Tanya said, we have about 17 different funding streams, and we're able to see in real time kind of how that spend down looks, which is incredibly helpful from a operational kind of organizational standpoint. So.
And I want to leave enough time for like questions and stuff at the end. So I'm not going to go too deep into this because I think it's pretty self-explanatory. I just want to say that this is what we operate kind of on a daily basis, you know, that we look at how many people need to be assigned out yet. So our queue, if you will, we only until this last year, we never had a waiting list before. But as they come up in the queue, we can assign out based on that and then look at like overall how many people are working with individuals. And that's pretty much our dashboards as well as like our spend downs. All of these can be created to serve each individual agency. So we have our supervisor's dashboard or the overall agency dashboard that we might look at, but each individual person on our team has their own individual dashboard too. So they can see like, how many people do I still need to get introductions for? How many people have I not been able to make contact with yet, or that completed contact with? Is it time to think about, you know, closing them out because, you know, I've made 5 attempts and haven't made that contact yet. So a lot of the work can be dashboard driven and not necessarily go into each thing. And they're so flexible to the individual's needs or the agency's needs to be able to do that. Because I too, like Christina, this is not my forte. People are. And so visuals and colorful things make my life happier and better. And all the other data stuff isn't the most fun. So I like to look at the dashboards, and I even when I'm working with my peers, I'm like, oh, look, you're green today because their colors changes, but it keeps our life a little bit more colorful.
And again, I don't want to spend too much time on this, but this is a look at the provider dashboard, making sure that the relevant data is there for different positions in the agency, right? So for our peer providers, making sure that the information and dashboards that power their work make the most sense for them based on the type of work that they're doing. So this is just a brief look at what that can look like.
Mm. And just some of the things that we have, you know, noticed in our own work is that we want to keep the work on the people that we work with. And so oftentimes when we've been a part of like studies or like different grants, that people can get so focused on like obtaining the information, and then the the wealth of information and the really the value of working alongside people is lost, that we are working with humans. They are at the center of the work that we do. We work for them. We wouldn't have jobs if they didn't trust us and want us to work with them. And so we want to continue to have it be pure focused rather than than completely data driven or trying to get those outcomes. And we need it to be easy to collect. We want it to be really provider friendly. So we've made drop downs. We want it to be click, 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 go. We don't want people typing a bunch of stuff. Sometimes if they do want to put comments in, they can. Many of them have figured out how to do like voice to, text. And so it just goes right in there for them because, we got people that still, just hunt and pack, and that's okay. We don't want them to spend so much time in the data. We want this to be a very small part of the work that they do so that they continue to have job satisfaction.
And then just picking out what pieces of data that you can use to increase funding and regularly report that back to funders. So here are just some examples of some different things. For instance, 39 total engagements in 2023, 25% increase in engagements in 2023 versus 2022, and 196 people with positive outcomes in opioid budget in 2023. These are just examples of things that you can choose to share what makes sense for your organization.
Yeah, I think that's it. What questions do you have?
All right, folks, so I'd like to invite you to raise your virtual hand using the reactions button if you would like to speak up. You can also put questions in the chat, and Christina or Tanya can read them there and get questions. Maybe I can prime the pump with a question of my own. I know this is kind of basic, but I'm very intrigued by the name of your team, the Drug Poisoning Prevention Team. I'm wondering what thought process went into coming up with the name of your team.
That just more or less came out of, so we have two pieces to the drug poisoning prevention team. So one of them is our direct service piece, and then the other is the African American Opioid Coalition. And so basically under that umbrella is that we're looking at how do we look at the top causes of injury within the community. Safe Communities does as a whole. There's 4 different arms, if you will, of Safe Communities. One is traffic safety, one is falls prevention, the other is suicide prevention, and then our team is the largest of them all, which is looking at overdose prevention essentially, and those negative consequences that come, deaths from substances.
Awesome. Do you incorporate self-help support groups as one of the community resources that you tap into?
We do that in a variety of ways. So we have, we obviously, our peers will support anybody trying to explore different things if that's something that we don't offer in-house. We also have peers that do peer-led support groups in the community in different spaces. So
thank you. I know that often self-help support groups are not seen as supportive of harm reduction. And I just wanted to share, I'm going to put in the chat a list of support groups that is very wide-ranging. It does include some abstinence-based groups, but it also includes some harm reduction-oriented groups for substance use recovery that might be useful to y'all.
Thank you.
You're very welcome.
All about resources.
Any other questions, comments, thoughts? It's a really exciting. I wish every provider had access to this sort of tool. I serve on a committee at my organization to work with Salesforce to develop something kind of similar to what you're doing, and I know how hard it is to put that work in there. I know it's really challenging, and it just seems so streamlined what you're talking about. Are you using a particular platform?
So we actually, Libby, are built on Salesforce, and we're on the App Exchange now for people to purchase it. And that just happened. As Christina shared, we didn't set out, we built this for ourselves because there was nothing else out there. And honestly, I don't think we would have arrived where we did had we not had the developer that we have, which isn't like a standard Salesforce developer. They just mostly do Salesforce work.
Yeah.
And then also another partner on it who used to work for Epic years ago, which is kind of like the big EHR kind of folks, and really spent a lot of time helping us drill down, like, what are the things that your agency needs and like, what do we need to do from the peer perspective rather than like really from that clinical perspective. Does that mean that it won't work for places that do both? No,
Yeah.
absolutely not. But we built this for peers by peers because oftentimes we're the ones left out of the conversation. We're the ones kind of
Yes.
thrown into something and we're the afterthought rather than on the forefront.
Yeah, I totally relate. I mean, when we were looking at using their case management pack, we were really worried about the phrase case management.
Right. It's
And
like it wasn't designed for peers, right? Like there's a couple of other things that were developed for peers, and the other places that we have talked to who have come on and using this our software was that these other platforms weren't that you couldn't modify it. So like if
Right.
you don't want to see something, we just hide it, right? Like no need
Yeah.
to bog people down with information that's not relevant to your organization or data collection needs. They would have to go back and write code to change it because we looked into that all before we did anything like this because this wasn't what we intended to do. We thought for sure something like this already existed for peer providers somewhere. And what we found was really sparse. And then, like Tanya said, we came up with this and we are not from this background of techie anything, but we're able to develop this and bring it really to the rest of the peer movement. And our hope is that this can be offered. I did drop the link in the chat, and that other peer organizations across the country, and we can come together and keep revisiting what are these data collection points? How can we make the biggest impact? How can we keep this movement growing together? And continue to get that feedback from the people doing the work to make the product better.
Exciting. Well, I'm certainly going to share it with our Salesforce consultant too. So I'm really happy to hear about it. Anybody else have comments, questions, thoughts? I'd really like to thank both of you, Christina and Tanya, for sharing and going through kind of the ins and outs of how you're approaching this within your organization. We so rarely get to share this kind of stuff. Oh, Angeline, go ahead, Angeline.
Hello, Libby. First of all, I'd like to thank you for giving us the opportunity for this program because I'm currently a peer support a newbie at Culver City. Absolutely fantastic program. Thank you. And the two presentators today, fantastic. I really like your information, but I would like a printed copy so I could put it in my book that I'm learning from Libby's program.
I can get that to you, Angeline. Don't worry.
Thank you. Thank you. Thank you again. And it's very, very informing. And I'm looking so forward to being able to complete the program and be like many of you out there helping the world like we need to. Thank you.
Fantastic.
Thank you. Thank you.
Welcome.
Thank you so much for having us. This is like where I landed, right? This is where my heart is. I wish there would have been something like this on the beginning of my journey for me.